Hi, I'm Dr. Perry Godalovich, and in this video, I'm going to be reviewing the consent form for breast augmentation. Breast augmentation is a surgery that is a day surgery done under general anesthesia. That means you are completely asleep for the duration of the surgery, which lasts about 45 minutes to an hour. The risks of general anesthesia today is less than driving in a car. However, there are some risks that you should be aware of, including deep vein thrombosis, which is why we've prescribed you some compression socks to bring and to wear the morning of surgery. The other most common complication of general anesthesia is nausea and vomiting, for which we have prescribed you some anti-nausea medication. You can also get a soreness in your throat, which is related to the tube that is going to be used to help you breathe during general anesthesia. And to help alleviate this after surgery, we recommend having some cough drops ready at home. For the surgery, the breast augmentation surgery, after your consultation, we will have discussed the types of implants and the type of incision used. The incision we use here is a small incision under the breast for about 4 centimeters to get the implant in. Almost 100% of the time, I'm going to be recommending you get a silicone implant because it is the most natural and the longest lasting type of implant on the market today. These are smooth silicone implants. We would have also discussed where we place the implant, which can be in front or in back of the muscle. Again, over 95% of the patients that I have in my practice, I will have recommended putting the implant in front of the muscle to prevent detaching the muscle, ruining that muscle, and also something called animation, which is every time you flex your pectoralis muscle, the implant moves. So most of the breasts exist in front of the muscle, and therefore the implant I will recommend going in front of the muscle. The exception to this is patients who have lost a massive amount of weight and whose skin cannot hold the implant, in which case we will be using the muscle to hold the implant in order for gravity not to happen too quickly. The risks and complications of a breast augmentation procedure are the following. You can have a bleeding or a hematoma. This is a collection of blood around the implant, and it can cause premature hardening of the implant. So it is something that we treat. It is not life-threatening, and it is not subtle. If this were to happen to you the same night, usually you'll notice that one breast is much bigger, much more painful, and much more purple than the other side. This happens in my practice about once every 5 to 10 years, so it's extremely rare, but it can happen. And if it does, we do go back to surgery to wash out and replace the implant. You can have a small amount of bruising, which is normal. Infection is extremely rare. In fact, I've never had it in my practice, but we do prescribe antibiotics to everybody routinely. There's going to be a little bit of swelling, and you can hear some air and some swishing on the inside, which is normal. You can even feel air going all the way up to your clavicle, kind of like a popcorn effect, which is completely normal after breast augmentation surgery. The scar is small and it is placed in the fold of the breast, but we can have issues with scarring. Some people have poor scarring and some people have better scarring. Generally, the scar heals very well, but it can take 3 to 4 weeks for that skin to be completely healed. We do not start any scar therapy until 4 weeks, and we try and keep it as clean as possible and dry as possible during that time. The main complications we discuss about breast augmentation have to do with the fact that there is a foreign body in your body. Once the implant is placed, the body is going to create something called a capsule around the implant to make sure that the body knows that this does not belong. We encourage you to massage your implants in order to keep that shell around the implant bigger than the implant and give you a nice soft effect. If there is premature tightening of that capsule, it's called capsular contracture, and it can happen up to 5% of the time. Usually it's just one side, so it can be kind of annoying because one breast will be firmer than the other. For the majority of the times that this has happened in my practice, which is only a handful, what we've done is we've just opened up under local anesthesia, relaxed the scar around the implant, and the implant will drop back down. Once in a while, and it's happened twice in my practice so far, I've had to completely remove the scar and the implant and replace the implant. The breast implant companies do offer some guarantee. So if this happens in the first 5 years, they will pay for the new implant, but not for the surgery. The other complication to discuss about breast augmentation is something called implant rupture. Implant rupture is when there's a small hole in the implant, and this is something that can happen fairly frequently. It's 1% per year and it's cumulative, but the reason people have 10 years in their head for changing out their implants is that after 10 years, the risk of rupture goes up to about 30%. Most of the ruptures are silent, meaning that you don't actually have to do anything about it, but you will detect them on mammography, and oftentimes I'll see patients back who will say, oh, the mammogram showed that I have a rupture. Do I have to do something? If you're not having any symptoms and there's no problems, you do not actually have to get the implant replaced. It's just something you need to be aware of. If you ever develop hardening or swelling, that's an indication to get the implant changed. Asymmetry is something that we always mention when we talk about breast surgery because the breasts are not twin sisters, they're just sisters. So there's always little differences between the two sides. Obviously, we do our best to make them as symmetrical as possible, but little differences will exist before surgery and after surgery. Other things to mention about implants is something called rippling. Depending on how much skin and fat you have in your breast, the implant can be visible and you can feel the little ripples. For the most part, this is not bothersome, but every once in a while in a very thin patient, this can become problematic. There are solutions and we will discuss them before and after the surgery. Nipple numbness can happen and it's temporary. The nerve to the nipple is not cut during the surgery, so you can regain nipple sensation, but it can take up to 6 months for it to come back to normal. Some women get extremely sensitive after surgery, and the same thing, with a little bit of massage, it'll come back to normal by 6 months. We discussed the scar. The last thing is implant malposition. It is extremely rare, but it would be a surgical error if the implant is placed either too low or too sideways. And if that were to happen, we would fix it. So in your consultation and in your consent form, we are going to be mentioning the type of implant used and also the amount and size that you are looking for. We usually do not discuss profiles, but low profile, moderate plus, and high profile exists. And this is a surgical decision based on the width of your chest. But if you're curious about what implant we've selected for you, just ask us and we will let you know. At the end of the consent form, there's a section about medical photography, and please answer that at your ease. There is no pressure from us. Thank you.